Welcome to this episode of Reid Beside You. I'm Eric Marsh, Executive Director of Whitewater Community Television, sitting in as guest host for Sherry Harlan, who is a little under the weather right now. And Sherry, we have you in our thoughts, our prayers, and hope you are better soon in doing next month's episode. We're going to talk about illness, as you would expect. In this time of year, the one thing that people are most worried about are three little letters, FLU, flu, or if you want to take the long way, influenza. It is out there and it is wreaking havoc right now around the area, and we want to talk about maybe how to avoid it, looking at some symptoms and what you can do to protect yourself, your coworkers, and your family members from getting it if that is possible. We have Dr. Jennifer Bales with us. Thanks for spending some time with us today.
Thank you.
And Kim Schneider, who is an infection control preventionist, right?
Yes.
Okay. Let's start with that title. What is a preventionist?
Well, there at Reid, the infection control preventionist, we work on helping make our patients safe and our staff safe from spreading infections, diseases, and things like that.
Okay. Want to find out a little bit about both of you all. It kind of helps the audience know who they're listening to. So, Kim, why don't you start? Give us just a little bit of background on yourself.
Okay. I started at Reid in 2006 as a staff nurse in the critical care. From there, I moved to the Innovation Center, which is the education department there at Reid, and then from there I went into infection prevention.
What drove you to infection prevention? What was the trigger that said, okay, this is what I want to go to?
It's doing the surveillance, and you still have the education piece of nursing along with it, and so doing a lot of staff education. You can go in, I can still educate patients about some of their infections and how to make them safe at home, and that was kind of the driving point.
Dr. Bales, how about you? A little bit of background.
Well, I'm an emergency medicine physician, and I've been at Reid for about 12 years. I also serve multiple administrative roles. I'm the medical director for occupational health. I'm chief of emergency medicine, and I'm chief of staff elect. I've been here a long time now, it feels like.
This conversation is about the flu, and we were talking before the show started, and I went, okay, how do you know when you have it? What are you looking for? Do you wake up and you have this little and you go, okay, I'm sick, I've got the flu. And you're saying, no, it's not going to start that way. That's not how you're going to feel.
Well, those symptoms are more consistent with a cold, which is a different kind of virus. The flu is characterized by a sudden onset of fever and really significant body aches. That is probably what characterizes it most or distinguishes it most from other viruses. You also get cough and shortness of breath. You can get a headache. You can get some nausea, vomiting, and diarrhea too, but if the vomiting and diarrhea are your primary symptoms, then you probably have yet another virus or a gastroenteritis. So it's really fever, body aches, cough, shortness of breath, and some headache.
Sounds like a fine line to figure out for people that
It is, it's difficult. Now, mostly colds are upper respiratory symptoms, so runny nose, congestion, and that little tickle in your throat that feels like a cough. Mm-hmm. And then gastroenteritis is more vomiting and diarrhea. So, yeah, there's overlap. It can be difficult.
How do you handle, how do you treat, how does the individual out there at home react to each one of those things, whether they think they have a cold or whether, yeah, they have that, okay, I've got the flu type of thing?
Well, so both of them truly are self-limited, but the cold is not nearly as dangerous as influenza. Influenza carries with it the risk of death. So if you're a high-risk individual, and that would be someone who's under the age of 2 or over the age of 65, or has other comorbidities, so any other illness that puts you at higher risk, so diabetes or cardiovascular disease, excluding just hypertension, or particularly lung disease, so COPD, emphysema, chronic bronchitis, asthma, those people are at particularly high risk. So if they develop flu-like symptoms, so again, the high fever, really bad body aches, cough, and shortness of breath, they really need to contact their provider or seek care at the urgent care as soon as possible, because there is a medication that can help mitigate some of the symptoms, but it needs to be started really early, like within the first 48 hours of symptoms, and earlier is even better.
talking about flu, talking about the severity of the flu from one year to the next, we always seem to hear, okay, there's flu out there, there's flu out there. But it does change from year to year. One, the type of flu, I guess, that's out there changes, and two, the severity of it. This seems like, from what we've been hearing in the news, like this is a pretty bad year. When they say widespread flu in Indiana, and Indiana is one of the states right now, one of 23 states that has widespread flu, what is it that you're looking for, and what are the numbers that kind of drive that?
Well, it's the positive influenzas that come through the labs. We report those to the health department. Like, I keep track of them each week, and I send a weekly report to Wayne County Health Department. For example, the widespread influenza in the state of Indiana, that means that we have had numerous high levels of positive influenza this year alone. And it's very different from last year. This year we have high activity, again, widespread, where last year at this point in time it was low in the state of Indiana for this week.
Okay. You were saying some approximate numbers or percentages of growth. You were saying there were like approximately 22, 25 cases or something along those lines test positive. This year the number is 300 or something along those lines?
Yes. Last year at this time we had 22 positive influenzas that had come through Reid's lab or the RHPA offices with 2 admissions. And then this year, by this week, we've had over 300 positive influenzas come through Reid lab and RHPA labs with many more admissions than last year.
Most people assume that at some point in time during the winter season in particular, they're going to get a cold. Is there any way to actually mitigate the chances of that, and particularly when it comes to the flu?
Well, you can help prevent yourself from getting the flu by, well, honestly, avoiding places where people with the flu have choose to go, right? So if you have the flu, the best way to stop spread is to not go out and to not expose yourself to other people. The flu is spread through respiratory droplets. So when you cough or you blow your nose, those liquids are your respiratory droplets, and that's where the flu is, and that's how you're spreading it. Typically, the danger zone around someone is about 6 feet. So if you cough, anyone within your 6 feet radius all the way around is going to be at risk from getting your influenza. So if you have sick, you can protect your friends and family by staying at home. Also, you can cover your cough. Now, if you want to avoid yourself getting it, what you can do is frequent hand washing. Because you can get the flu from inanimate objects. Now, it's a virus, and so it lives most primarily within a living host. So it doesn't survive very long in inanimate objects, but it can, like on grocery carts and doorknobs, exist for over 24 to 48 hours. So you're getting it even when you just go to the store. So frequent hand washing can help prevent that.
When you go in, is actually wiping the cart handles and things like that, does that actually do anything?
It's worthwhile for the flu because the flu is a delicate virus outside of the body, and it doesn't take like aggressive bleaching. Just simple soap and water can eliminate the flu on inanimate objects.
You cough into your hands. Now, there was a point in time where people were trying to teach you how to cough. Is there actually a better way to cough so that it doesn't spread?
There is. If you could cough or sneeze into your arm. So if you have to cough or sneeze, you take your arm up like this and cough and sneeze into your arm to cover your cough.
That keeps it from getting out. Do you immediately take your clothes off and start washing at that point? Again, you talked about not being an inanimate object, having a difficulty living on an inanimate object. So that, I assume, would then kind of help negate that spread at that point also.
Right.
Okay. We're down to our last couple of minutes. Want to talk a little bit about flu shot. You start hearing about getting a flu shot almost late August, early September. At what point and how much time do you need to get it for it to be active in your body so that it has a chance of working for you, as it were? And how late in a season can you get it? We're into January, this will air in February. Is that too late?
Well, so technically speaking, the flu season extends from October 1st through March 31st. And the CDC recommends that you get your flu vaccine by October 31st. Once you get your shot, it takes about 2 weeks for you to build the immunity, and then you are protected. That being said, since flu season is going to go all the way till March 31st, really any time that you get the shot during that season, you're going to help protect yourself.
Okay. Anything we need to know? You're the preventionist. What advice, we've got about a minute, what advice can you give us to help prevent education, to help prevent the flu and the spread of the flu?
If you can think of the 3 C's, so clean your hands, wash them frequently, make sure you're using soap and warm water. You want to rub them, use friction for at least 20 seconds. So think of singing the happy birthday song twice in your head.
I've never heard that.
Yeah, so, and then make sure you're washing the back of your hands and in between your fingers as well. The second C is cover your cough. So again, just making sure that you're not coughing and sneezing all over the place. And then the third C is containment. So if you're sick, don't go to school, don't go to work.
Oh, you just made some people happy. Don't go to school.
No, don't go to school, don't go to work if you're sick and you have that fever. Because, again, you're going to spread it to your classmates, your co-workers, and then, you know, then it just goes from there.
What's the average length of time it will take someone from the time they figure out they've got it till the time probably they're well enough to go back to work?
Well, so when you're exposed to the flu, you typically develop symptoms within 2 to 4 days. The day before you develop symptoms, you're contagious, so you don't even know you have it, but you can be spreading the flu virus. Yes, I know. And then you're typically contagious for around 5 or 6 days after you develop it. So most people wait till they're sick before they decide they're not going to go to work because they don't even know they have it, so they can't be blamed for that. And then most of the time you feel really bad for 3 to 4 days. You are still contagious probably for a day or so after that.
Okay. We're going to take a short break. The doctor is going to stay with us. We'll change out guests and we'll be back with Reid beside you as we continue talking about the flu here on WCTV Channel 20.
Life can sometimes be chaotic. And with small children, it can be difficult to get to the doctor.
Hi, Mrs. Towns. How are you doing?
I have a sick little boy right here. I think he might have an ear infection.
With Reid Health Now virtual visits, you don't even need to leave your home.
I'll send in a prescription for him.
Quick, easy, convenient.
I don't want to take the kids out today.
Oh, hey, Doc.
Reid Health, right beside you, right now.
And welcome back to Reid Beside You. I'm Eric Marsh, Executive Director of WCTV, guest hosting for Sherry Harlan on this month's episode of Reid Beside You, having a discussion about illness, particularly the flu. And we're joined by Monica Schlicther, who is the operations manager of operations for urgent care for Reid Health. Started by asking the ladies in the first segment to give us a little bit of background. Why don't you give us a little bit of background on yourself?
Okay. I graduated from the radiology program at Reid in 1996, so I worked in radiology for 20 years, and then at the urgent care the last 6 years doing radiology and MA work, and then moved into the operations manager position in August.
What do you like about the urgent care part of the work?
It's great because it's just, we have x-ray right there, we have lab. I mean, it's just pretty quick and convenient for patients to come and get care, adequate care and get everything they need, kind of one-stop shop kind of deal.
Urgent care, I imagine you would be, I think, one of the first places that people would go when they feel those symptoms coming on. Is that the case, or are you back of mind for people?
Yeah, well, this time of year, people have trouble getting into their primary care because they're so busy. So, yes, so typically they would come to us first, and if we think it's a case that's too complicated for us when we assess them, that they're having complications from the flu or something, then we would refer them to the emergency room. But yes, we can be like the first line of defense to assess and see if they truly do have the flu and if they're at risk and need antiviral medication like the Tamiflu or Influenza.
And talk a little bit about medication for this, because, you know, we're used to, at this point, we're sick, there's a pill, there's a shot, there's something that will make us better pretty quickly. Is that the case with the flu? Is there something, is there a magic pill? Is there something that will go, all right, this was going to be 6 days, now it's only going to be 3?
Well, I don't know that I would call it magical.
Good question.
So the flu is a virus, it's not a bacteria. So you can't use an antibiotic. Antibiotics are very effective against most bacteria, most of the time. But it's a virus, so it's more difficult to treat. And for the most part, whether you take the medication or not, it has to run its course. Generally speaking, we tell people that Tamiflu can reduce your flu illness by 1 day. So what was going to be a 7 to 14 day illness can now be a 6 to 13 day illness, and it can reduce some of the severity of the symptoms, but it is still going to run its course. Now, that being said, if you're a high-risk individual, the medication can help prevent hospitalization and death, so it's worthwhile.
We've said that a couple of times, that there have been deaths from the flu. Is it really a death from the flu, or is it caused, is the flu severe enough that it triggers something else?
Well, it's a combination of both, really. So the biggest risk with influenza is respiratory failure. So you just get so short of breath that then you can't breathe and you get lung complications. But the flu can exacerbate any of your other underlying comorbidities. So certainly if you have something like COPD or asthma, you're at very high risk for the flu, making your chronic condition exacerbated. Also congestive heart failure and diabetes, anybody with those is at high risk.
People worry about or think about urgent care. They're wondering whether they can get the same quality of care, same type of testing from urgent care as they can if they go to the emergency room. What's the difference between the two, and how does someone know whether urgent care will be where they need to be or whether the emergency room is where they need to be?
Well, we have the ability to test for influenza A or B, so it takes about 15 minutes to get those test results. So we have the lab right there in our office, so we can do that very readily. We can also order chest x-ray in the office. All of the facilities have chest x-ray, have x-ray ability except for the Ready Care at Meyer, so the other 3 facilities do. So we can do all of that and assess for your initial diagnosis of the flu, and but if you're getting things like dehydration because you can't keep fluids down or becoming just progressively worse, then yes, then you may need to go to the emergency room. But we can still assess you and see if that's the case before we would have to send you down.
You just showed up on screen the 4 locations of your urgent care. Are they all outside of, you mentioned the one thing you can't do at the Meyer, are they all pretty much equal regardless of where people go?
Yes, they're all pretty much standardized. We have a great group of providers, and they all can provide the same care at each facility. Meyer is a little bit limited just without the imaging, but they can still provide influenza testing.
What are the hours that urgent care is open? And I assume that would make a difference for some people as to whether they're doing urgent care or whether they're doing emergency room.
Sure. So all 4 places are open 7 days a week. So the Richmond facility is open 8 to 7, 7 days a week, and then all 3 of the other ones, including the Meyer Ready Care Clinic, is 8 to 7, Monday through Friday, and then 8 to 3 on Saturday and Sunday.
As people start to look at feeling better, getting over the flu, getting through this time, what is your suggestion? You see a lot of people coming in and out. We got some suggestions in the first portion. Is there anything that you can tell people that they need to be doing, thinking about, trying to avoid when dealing with the flu?
Yes, just like Dr. Bales said, just to stay home. I mean, it's hard for people to do because, well, you just get you don't want to stay home so long because it takes a long time. But like I've had
And you
employees,
get your boss leaning
yeah,
on you a little bit too sometimes.
But I try to be very lenient with it because I don't want them to come there and get everyone else sick. So if they have flu symptoms, we make sure they're completely symptom free before we let them come back. But we definitely have had a round of our providers being sick not long ago, and it just, was going through, and then some staff as well have also tested positive for influenza. So, yeah.
And when people come in, they're needing notes sometimes for if you're off for 3 days, you're good. If you're off that 4th day, you need notes.
Right.
That's something that urgent care
Yep.
can handle and provide for people also.
Yep, we can certainly provide that.
We're talking about flu, but real quickly, some of the other things that urgent care will take care of for people, because there's always this debate, and I've got you here, between going to the emergency room, going to an urgent care facility.
Yes, that is a big debate actually, but we can handle minor things. But if you're having like severe chest pain or the worst headache you've ever had in your life, or things that are just really abnormal for you, your blood pressure is really high and you're having chest pain, things like that, we can assess you and see what's going on, but those are things we're going to probably send you to the emergency room for. Severe abdominal pain, not just like a little tummy ache, possibly, but just severe kind of symptoms, chest pain, arm pain, jaw pain, things that might be cardiac related.
Stroke-like symptoms,
Yes.
shortness of breath,
So
not
we-
able to tolerate fluids, visit
Right.
vomiting.
Okay.
So those are things you definitely want to just go to the emergency room for. But if patients question, like, I don't know, maybe I could do, they can certainly come to the urgent care, and then we will triage them right away, decide if they can stay, if we have the capability of taking care of them well, or if they should go on for further treatment down to the emergency room.
We talked real briefly about flu shots, getting flu shot, the importance of flu shots. Some of the things that I was reading said we kind of knew this was going to be a bad season because things in Australia were a little bad.
Right.
What is the correlation between Australia and our ability to tell whether we're going to have a bad flu season?
So the flu is a virus that has what's called antigenic drift. So it changes. It changes over time as it moves in and out of human and animal populations and spreads around the world. So the World Health Organization monitors the flu virus all over the world, and then they give that information to the FDA and the CDC early in this year. So for the 2017 flu season, they got that information in February of this year. And they had to make that determination at that time what would be in the vaccine. So, and the vaccine's different every year. That's why you have to get it every year. So there are 4, at least the one we provide at Reid, there are 4 different flu viruses in that vaccine. That vaccine does not contain the flu virus that is hitting us hard now. It was a miss. Right?
Okay.
You have to guess 8 months in advance. It was a miss. Australia is the southern hemisphere, and so that's where closer to our flu season you can kind of predict what we're going to see based on what they see, but that's not early enough to help us decide what we're going to put in the flu vaccine.
Okay, then I'm going to kind of follow up. When people say, I'm not going to get the flu vaccine because it's not going to protect me more than likely from what is, how long will that vaccine hold as you go forward? The flu shot that I got this year, will it still be protecting me from some of those strains next year?
So generally not, because you only get one. So your general protection's going to last about a year or so. So maybe slightly into the next year, but not a lifetime immunity like some other vaccines that you get again and again, separated by several months, like as a child. Okay. So it's not going to have that kind of protection, but it should protect you through the flu season. And even though what we're seeing right now is not necessarily covered by the flu vaccine, it still has some preventative qualities. They're expecting it to have about a 20 to 30% prevention rate for influenza. But even if it doesn't protect you from the flu, exactly, from getting the flu, it can still protect you in other ways, because it's been shown that even if you get the flu, if you had the flu vaccine, it can sometimes prevent hospitalization and prevent death. So it can decrease the severity by giving you some degree of immunity. It's worthwhile even if you still get the flu.
Okay. Anything that I have missed that you feel like the community really needs to know going forward right now?
Well, I think it's important with regards specifically to influenza to know when to go to the emergency department. And again, the big risk with influenza is respiratory failure. So everybody who gets the flu is going to be a little bit short of breath when they get up and walk around and they're active. But if you are short of breath when you're just lying in bed, cuddled up under the blankets, you shouldn't be that way. And that's a concern. At that time, you probably need to go to the emergency department. Another risk is dehydration. Now, sometimes there's vomiting and diarrhea with the flu, but even if there's not, you can still become dehydrated because you have a poor appetite and you're going to lose fluids just because you have the flu. So if you're beginning to feel dehydrated, your lips are really dry, your mouth is dry, you can't take in the fluids for whatever reason, your urine output's decreased, then that's a reason to seek care. Most likely at the emergency department would be the best place versus the urgent care. Also, if you're confused or altered, not acting like yourself, it's time to go to the ER.
Okay. Monica, anything from your standpoint that I've missed, something that the community needs to know in this instance?
No, I think you guys have covered it really well. I think, we can, like I said, do the initial assessment and get you on the right track and decide, what course of treatment you need. Let people know that they need to rest and get fluids, and if things do become complicated, then they need to follow up, with shortness of breath, like Dr. Bales said, or the dehydration, or things that can come with complications from the flu that can turn more serious, so they have to take it serious at that point.
And if you're a high-risk individual, then you need to seek care early, and the urgent care is the perfect place for that. So you're not that sick yet, but you have one of those other medical illnesses that put you at risk, the medication's going to do you the most good if you start it within 48 hours. So, if it's a Friday, that means you need to go to the urgent care to get that care, because you can't wait till Monday to get that prescription at your primary care office.
Okay. Monica Schlicther, Dr. Jennifer Bales, thank you very much for the information, and I'm going to go wash my hands.
Yes.
Thank you for watching this episode of Reid Beside You. Join us again next month.